Hello, Gaston County. Welcome to episode number 151. Yeah, are you surprised as I am that people are still listening after 150 episodes? And officially, we are calling this the start of season 7, as somewhere along the line we decided that we were going to have 25 episodes per season. So that math works out correctly, right, Naomi, to season 7 now. And it's been 2 months maybe or so since we released an episode. We took a little break, but again, we are still Gaston's Great, a podcast highlighting some of the great things happening in and around Gaston County. I'm your host, Stephen Long. We are again coming to you from the worldwide headquarters of GSM Services here, right here in downtown Gastonia. However, we are going to shift gears slightly for this episode and some of the episodes going forward, as we're going to be highlighting maybe some more individuals instead of just community organizations who are involved in our community. Discussing some leadership stuff, discussing some business stuff, discussing some community involvement. Again, we'll still highlight some organizations as they come along, but after 150 episodes, we've talked to most of the organizations who were actually willing to come talk to us. But today, I'm very happy to have Dr. Brian Wysong with us today. Brian, I have a connection through Rotary and some community and have children the same age, so we've known each other for a while. So, Brian, it's great to have you on, and welcome to the podcast.
Appreciate it. Happy to be here.
Absolutely. So, we're going to get right to it as usual. So, just first simple question, just tell us a little bit about yourself, anything that you would like to share.
Yeah, well, first of all, I'm the first episode, and you probably saved the best for last, right? So I'm not sure what to think about that. So,
maybe.
Yeah. So we'll start there. Yeah.
We could be, this could be 20 years later, we're still doing episodes, so we may never have a last one. So,
all right. Good point. All right. I like that. So I'm from a small town in Georgia, Hartwell, Georgia. I'm sure people have heard of Lake Hartwell.
Yeah. Absolutely.
So grew up there. Born and raised. My dad's a physician there, small town physician. I'm a New Year's Eve baby. My dad delivered me. Yeah.
That's interesting.
So,
I didn't know that.
I'm not sure I was due on New Year's Eve, but tax write-off issues and stuff. So I came out either way.
He decided for you.
That's right. Yeah. He said he didn't drop me or anything like that. So I take his word for it. But grew up in a small town, saw my dad, who was a family physician, took care of most of the town because there's only a few doctors in town. So, right. People driving down our driveway any time of day, weekends, whether we're out working in the yard or whatever. I grew up on a little small farm. So, had some great experiences growing up, learned to work hard. Saw my dad work hard. A lot of times if I wanted to go hang out with my dad or see my dad, I was going to the hospital or going to a nursing home or actually, making house calls with him and stuff.
Yes, that's a little different. Don't see too many house calls these days.
We actually do them, actually.
Do you?
Yeah.
Okay.
We're taking a little old school, but
interesting.
Yeah, and that's something I grew up and I love that. I loved going out and seeing these folks, and I've seen how appreciative they were of him coming out and seeing them and taking care of them. Had a couple favorite spots. Like I had one lady, her name was Butch, actually. Interesting name, but she made me an apple pie when we go see her. So she lived on the lake also. So I got to fish and eat apple pie. So I was always in on that trip. Yeah.
But that's a worthwhile adventure there, huh?
So, but great community. And, grew up with that. You didn't get away with much in a small town. That can work against you sometimes, but just seeing how my dad cared for our community and the mutual respect and love people had. And, I've always really enjoyed that. And as I got older, trying to figure out what I wanted to do in life, I said, you know what,
So is your dad, is that what inspired you to get into medicine?
Yeah, it really was. I don't tell him that. I don't know if he probably won't listen to this anyway.
Well, we'll find out. We'll make sure we send it to him.
Yeah, he did. He actually worked for 48 years. He was a family practitioner in our small town for 48 years. Started that practice himself and worked really hard through the years, but he loved every minute of it. In fact, I didn't think he was ever going to retire. He just couldn't see himself doing anything else.
Yeah. Well, I'm getting old enough to where, I'm not retiring anytime soon, but it has, I'm 54. You get into your 60s and then 70s. If you're lucky enough, hopefully I'll get there. That's when you start thinking about those things.
Sure.
And, just a few years ago, it wasn't even on my mind at all.
Yeah.
What about medical school, college? I know one college you're a fan of that will allow you to. We will allow you to speak
Go dogs, right? So, I went to the University of Georgia, met my beautiful wife in a Friday afternoon lab that we were both trying to get out of. God has a sense of humor, right? But met my wife my sophomore year, I believe. University of Georgia, majored in microbiology. Knew I didn't want to work in a lab and had to go to med school, so and went to Medical College of Georgia. And then after Medical College of Georgia, I trained in Spartanburg at Spartanburg Regional for 3 years.
Okay. Not far from here at all.
No, super busy hospital. When I was looking at residencies, I said, you know what? The last thing I want to be is incompetent when I get out of residency. I want to be able to do anything and everything. And so I picked the busiest hospital I could find where I could get the most hands-on experience I could get. And Spartanburg was definitely that. Sparkle City. So we lived there for 3 years, had a great 3 years. And then actually from there went to South Point Family Practice in Belmont. So that was my first job out of residency.
Okay.
So moved up to G-Town.
Oh, wow. So what time frame was that?
2006.
2006. All right. So almost 20 years here. So that's long enough. We consider you we consider you a local.
That's right.
Okay.
Well, I consider myself a local at this point.
It also depends. You came north to get here too. That also helps.
Yeah. Well, it's always funny when I try to explain to a patient why they shouldn't drink sweet tea. It should be unsweet. They're like, "What are you from the north or something?" I'm like, "Actually, I'm from south of here. Let's just go ahead and talk about that."
Yeah, we won't talk about that.
And Sundrop. Actually, Sundrop is a G-Town thing, Gastonia thing.
You know what? I grew up on Sundrop, but I haven't had a Sundrop in probably 25 years for lots of different reasons. Yeah. That is almost a whole you, Naomi. I appreciate you reminding me that I'm, as you do every week, that I'm old enough to be your father.
Wow. This is liver mush and Sundrop country. That is a very much Gastonia thing. That's great.
Well, is that job security for the medical?
That's true.
For the medical industry here locally.
Yeah.
So, all right. So you shared a lot there, but I'm sure there's a lot of details that you didn't leave out. I mean, you kind of didn't get to. So, can you tell me let's just stay with your career in medicine for just a minute or two. What have you seen? Have you seen medicine change, and then kind of get into your journey to kind of where you maybe where you are today?
Yeah. So, I mean, the reality is, and I tell people this about physicians, you've been in school forever. And so, when we get out of residency programs and I did a 3-year residency. Some people do 9 or 10-year residency. Some people do fellowships on top of that. So we're talking about, these are guys later in life, they're just now getting a job, like really actually making some money. So, you have debt and you have kids typically or families at that point. So it's like, okay, I need to get a job, right? And anybody that's your support system's like, dude, you need to get a job, right? So, when we moved, and I looked at different areas of where I wanted to practice. And for me, it was about finding some balance because my dad worked 7 days a week. And I loved what he did, but there's got to be a balance in life. He missed a lot of my ball games and things like that growing up. He did what he could to be there, but the reality is, I kind of wanted to be more involved with my kids. And so, the practice, it was actually a private practice. South Point Family Practice was private when I got there. Within 6 months, they there were some new Stark laws that came about. They had an affiliation with Navant, which was at the time was Presbyterian, where Presbyterian was helping them manage their office and helping them with the business perspective of the practice, whereas the guys that worked there, they were busy taking care of patients. And these guys, what I loved about the practice was that their philosophy was, hey, we put patients first. If a patient needs something, we meet them at the office. We go to their houses. They were going to the hospital still. We were doing hospital rounds at the time, which was in Charlotte. But it was, hey, you put the patient first. If you do that, everything falls into place. Like you're going to be busy. And we try to tell, we've told hospital systems that, marketing, teams that, and stuff like, listen, we don't need a billboard. You take great care of patients. Word of mouth will blow you up. And
Frankly, that's the same in our business as well.
Right, exactly. So I came into a practice where a couple of providers had left, moved to different areas of the country, and so I had a lot of patients were in need of a provider, and so I stepped in, and and I grew up in a very similar type town, and small town and stuff. So people love that, and we got along real well. And I like to cut up and have a good time, but take care of patients. So and I've always been a hard worker, so I came in running and. And ran hard. So, but the philosophy was, hey, you take care of people and and put them first, which is a belief I have as a Christian too. But at the time we were going to the hospital, that changed. It got to where you actually lost money by going to the hospital, and so I would get up at 4:00 in the morning to get into Charlotte, which that got worse and worse through the years. So it got to where we said, you know what, we need to stop going to the hospital. And they started coming up with hospitalists. That was a new thing a couple years into it. So you see us start getting out of the hospital saying, okay, we're much better off staying in our offices, not going to the hospitals. And they have hospitalists now. And so you see us kind of getting out of that part of medicine, which good and bad. It put a lot of extra work on us, but it's kind of nice having that continuity of care and knowing your patients and being able to take care of them, in or out of the office. So I kind of started seeing that. And then getting back to the Stark laws, we were basically told by a Presbyterian, listen, these new laws have come about. You either have to go totally private or totally under the hospital system. You can't go in between because they consider that like a kickback. Like it's like you're incentivized to send referrals to that particular hospital system, even though we didn't do that. It didn't matter, but that's kind of where the laws were. Okay. So, maybe good intent, but once again, it drives us one way or the other. So actually,
there's always some unintended consequences or anything like that.
Sure.
Probably.
Yeah. So at the time, Caramont was really wanting to acquire South Point Family Practice, and Wayne Shovelin was the CEO at the time. I knew Wayne pretty well.
Yeah, I did too.
Yep. So Wayne and I got to know Wayne really well when I moved here. But Wayne and those guys said, hey, we want you guys to be our model practice. We're going to help you guys thrive. We'll help you add services. We'll stay back and let you run your own business, run your practice the way you do it, because you guys are successful and take great care of patients. You have a great reputation. So, for years, that was kind of the way we went. Most people didn't know that we were even affiliated with Caramont for years because we were South Point Family Practice and nothing changed. We ran our practice the way we wanted to. As years went on, things changed. Wayne retired. We had new CEOs coming in, and medicine changed. And it kind of got to be where everybody wanted to do things the same. They wanted to centralize phone systems. They wanted everybody to be on the same medical record systems, things like that, which can have some benefits. The problem is they have to be done, appropriately. And we found ourselves where patients were complaining they couldn't get somebody on the phone. They couldn't get appointments. They were frustrated. Labs and things like that were, there was a lot of things happening, billing, coding, things like that were changing behind the scenes. And so we were getting frustrated, and we try to come in and say, listen, what's wrong with the phone system? Like, this is important. Like, patients need to be able to communicate and make appointments, and and not putting the blame on certain people, but it's just, we couldn't get anything done. It got to be where it was so much bureaucracy and so many hoops to jump through that literally we were confined to, you see the patient, be quiet, and we're gonna manage the rest of it. And some things happened, and it got to be just a volume deal. Like, we were just coming in and running that rat race and trying to get patients in and out, and it just wasn't the same. You just didn't have that sense of that you had control of the practice and being able to take care of patients the way you wanted to. So that kind of led us. There were some other things that happened. Won't get into that, but we decided, you know what, we're gonna get out from the hospital system and try to do our own thing. We're going to set up a practice and run it the way we feel like it should be run. Take good care of patients. So we left, and there was the hospital didn't like that too much, and we had a little bit of trouble for a few years, and we set our own practice up. And actually, we enjoyed practicing medicine again for a few years, but it was tough. And the problem with medicine is that insurance companies really drive the way things are.
Understood.
Okay, they control things.
Insurance controls things that we can do at our business.
Right. Yeah. So, but as a small practice, you have no negotiating ability, because in their eyes, they say, well, you only have, so we had 7 providers at the time. Well, you only have 7 providers. You should be privileged. You should be thankful that our patients are able to see you. So we're going to give you certain contracts that are not very good. So if you have bad contracts, then the way you make up that production or that money coming in to pay your bills, pay your staff, do all this stuff, is you have to see more patients, right? So it becomes very much a volume business. So it's always a volume business when you're under that model, but it becomes more so, when you're a small group. That's why you don't see a lot of small practices anymore. They can't survive. They can't survive under the traditional model, at least.
Right.
Because insurance will just eat them up.
So, from the time you're when you're growing up and you're seeing your dad, is the big business side? And then let me back up a question. When you were in medical school, was there any business training done?
No.
Well, see, I came out of engineering school, right?
Sure.
No business training.
Yeah, right.
And I wasn't smart enough to go take some business classes because I'm going to get out and do my thing.
Right.
So I had to learn all the business side from the industry or the please don't fail too badly that you can't get out of it business side. So I think I already knew the answer to that question, but I think sometimes people think that engineer, you come out to and you end up running your own business, and you had some professional training, college education along the way, and maybe you did, but most of the time you don't on the business side, because I'm pretty good at HVAC and engineering, but the business side I had to learn the hard way.
Well, and that's us. We're great. We're good at what we do. We're great at medicine and taking care of patients. The problem is how does that transition over to the business part of it? And once again, it's very intimidating. There are a lot of facets to it. There's a lot of negotiating of contracts if you're going to play the game, the insurance game. But then you have to have a staff that also does all this work. There's a lot of denials. And sometimes they just deny things to deny them. It's like, okay, what did we do wrong here? Well, there's nothing. You just have to resubmit it. You resubmit it.
So how would you? So on that journey, a lot. And listen, I realize that we don't have 2 hours for you to get into details, but I've heard some of the story just from you.
Yeah.
And our time together. So what led you to? How would you describe your practice now?
Okay.
And is that a trend that you're seeing more across the country or in the world or whatever? And because I know that there are some people that just aren't familiar with what's the short version of how you describe that?
All right. So I'll tell you kind of how I got here. And to your point, as far as no business experience, I had a lot of business. I had some business experience at South Point because we got to run our own business. So P&Ls, things like that, I understood. I understood how insurance is negotiated contracts because we got involved some with that. But also saw that it took a big group to really negotiate. Otherwise, they don't negotiate with you. It is what it is. So when we left, we said, okay, we're going to have to deal with this. We're going to have to contend with this. So when we left, we tried to join a bigger private group. But what we found is that they were actually managed by private equity. Didn't know what that was.
Private equity is huge in our industry.
So
they're buying up companies all over the country.
They're buying up dental practices. They're buying up medical practices. They're buying up podiatry practices. That's gotten huge. And so, but what I realize a private equity group does is they build value. They have to build this value, and then they sell that entity for a multiplier of that value. And then the next group comes in, and guess what they need to do?
Do it again.
Right.
Same thing in our industry. Yeah. Matter of fact, most of our local competitors are now owned by private equity.
Sure. Sure. Because if you're the owner and you're close to retirement or something like that, yeah, this is a good cash out, right? And they sell it to you. It sounds great. They sold it to us, and man, the guy leading that charge, it sounded like an ideal world. They're going to manage our business. We don't have to do that. We're going to take care of you. You know, you just do what you're good at. You take care of patients. Fantastic. That's what we want to do. But then what I realized, you start looking at finances and where that's going, and that makes you a little queasy and stuff. There's not good medicine for that, you know, when you're in that situation. So we said, all right, we're not doing this anymore. I'm too far along in my career, and I said, you know what, I was working 14-hour days, 5 or 6 hours on my off days, working weekends, vacation days, taking computers with me. It's like you can't keep doing that. And so myself and 2 partners stepped out and said, all right, what do we do now? Do we go just work for a group? Do we just work shift work for a hospital? What do we do? And so when we got out, I said, all right, what's it going to take for us to open a small practice and not have to contend with insurance? And I had friends down in Greenville, Spartanburg. They've been doing what's called direct primary care for about the past 12, 13 years. They started out with cash clinics. And but the guy that started this, he was actually he was a business major at one point, and then later on went back and went to med school and all this stuff. He actually started Grubhub before there was internet. He said if he had internet back then, he'd be sitting on his yacht right now, which he's right, because he started a food delivery service back when he was at Marshall. And so the guy's very business savvy and all that. So he started with a cash clinic and then built it into what's called direct primary care. So what direct primary care is, and most of these go to companies. So like they would come to your company and say, all right, we'll take care of all your employees. You pay us a monthly fee per employee, and that includes all their care. If they need to be seen, they get hurt, they need x-rays, they need labs, they need anything done, they come see us. We take care of them. We're available. We're 24/7 on call. We keep them out of urgent cares. We keep them out of ERs. And there's all kind of data showing that there's a lot of savings there because you're not getting you're not getting all these inflated prices. You're not getting all this you're not getting all this extra stuff done you don't need. All these, labs, these protocol stuff. And so they've been doing this, like I said, they've been very successful. Actually, it's gotten to where now, because of the cost of insurance for businesses and what they're paying in healthcare, they're now talking to some of these brokers to where they set up their catastrophic coverage in different ways and their benefits in different ways than traditional insurance. Saves them a fortune, and then they sign on with these DPCs that take care of all their outpatient needs. And it's a win-win because they get better care. Yeah.
And they're still covered on the catastrophic stuff.
Yeah.
So which is really what my view is what insurance was originally set up for.
Correct. And so these guys, they've been very successful. So I go to them and say, all right, my problem is because I had about 4,000 to 5,000 patients that I took care of, just my patient panel, which is ridiculous. Most busy providers are about 2,500. But I also have a hard time saying no. So people would, hey, can you see grandma, or can you see my dad, or they're moving down here, or my friend needs this. And so you're like, yeah, sure. But after a while that gets out of control. But my partners also had about 2,500 apiece. So between the three of us, we had about 9,000 patients. And we said, okay, we love our community. We love the people we take care of. How do we not leave them out in the cold? How do we still take care of these people? Like, how much does it cost? Like, how much is it for me to run labs? How much is it for me to set them up to do, imaging or whatever if they need it? Because that's the concern. So once I got out, we started looking at how much are labs. Well, what we started realizing is that it really doesn't cost that much to take care of people. I was actually shocked. And so then I said, all right, I kind of backed my way into, all right, how much are we going to charge per month to just avoid, not worry about insurance, not worry about anything else. They pay their monthly fee and we take care of them, whatever they need. I take skin lesions off. I do injections, whatever they need. Manage their chronic illnesses. We get their labs. And I was kind of surprised, like I said, at how inexpensive that was. In fact, I was sitting out there cleaning my pool thinking, I would pay a pool guy more than somebody would pay me to take care of them. and how's that? That's not right. Wait a minute. I pay a guy to cut my grass. I pay him more than somebody would pay me to take care of their health. And the more I thought about it, I'm like, this is crazy. Like,
yeah.
So anyway, that's kind of how we ended up where we're at. And I think a lot of it's been educating people. I mean, people that are part of our practice love it. I mean, we literally are available.
Well, is it fair to
24/7.
say though that, gosh, something it's going to feel like a dramatic change?
It's crazy.
And people we're so in tune and used to the way the system works or whatever, that it's hard for people to grasp. It is also, am I right that the common phrase used is concierge medicine? Is that a word that people may have heard?
Well, and that's the thing. They say, all right, they're concierge. We can't afford that. That's what I get all the time. In fact,
Fair enough. Yeah, that's a word that seems.
Yeah. And so we actually, at first, we said they got concierge service. And I said, all right, take concierge out of everything. Because that's
fair.
For normal people, they're like, whoa.
Language does matter.
Yeah. Because if I go to take a cruise, I'm not paying for concierge, so I understand that. But there's a difference. Concierge is where you pay a monthly fee. That's only to be included in their patient panel.
Okay.
So basically, you're paying to be my patient. That does not include any service. Like, you're still going to have your insurance to pay, and you're going to pay copays, you're going to pay deductibles. If you don't have insurance, you'll pay for that visit. So it's like no different than any other practice, other than you're paying a monthly fee on top of it to be part of their practice.
Okay.
Now, you'll get better care because they're only going to have about 300 patients, 400 patients versus 2,500.
Okay.
So that's the difference. You get great care, but it's really, to me, it's for people that have money, people that are wealthy. So once again, that's not our patient population. And we said, how do we take care of these people? Like, how do we take care of our blue collar folks? Okay.
Yeah.
And so that's what direct primary care to us was like. This makes a lot of sense. And actually, for most people, it actually saves them money. We find ways to save them a lot of money, especially the chronic health conditions and stuff.
Right.
So anyway.
So is it fair to say, just kind of summarize this up, is that we have choices. There are choices out there available now besides the traditional view or the traditional type of medicine.
Absolutely. Yeah. So I will tell you my personal story with my family. So we had traditional insurance, and I paid about $2,800 a month for traditional insurance for a business plan. And now we have a share plan, which actually is better in that if something happens, if we have what we call an event, anything above $1,500 is shared, which means they cover anything above $1,500. And the premium on that is $600 versus $2,800. And then we charge $140 per adult, $300 for an entire family. So my family pays $900 a month for better coverage than we've ever had. And we're saving almost $24,000, $23,000 per year in premiums, which happened this past year. Like, I literally saved personally in my business. You could think of it as a business expense too. So we have 3 partners. So between the 3 of us, our business saved over $70,000 in an expense. And we feel we have better coverage, which we do, if you think about it.
All right. That's interesting. So,
yeah.
So our listeners out there, the point of this wasn't really to talk about, specifically, we just want to talk about how things have changed in the business side. And so I'm going to, so I appreciate you sharing all that, Brian. It's an interesting, for me as a business owner too, with a 260 plus team, individual person team here. It's just, every year we do look at what are the options, because the cost of is getting out of hand. I'll just leave it at that, and
we hear that all the time.
Because we want to provide the best we can for our coworkers. Absolutely. And so, so that's the kind of thing that we were always looking at and analyzing. So again, I appreciate you kind of get into sharing, and then it's interesting. I'm sure, I wonder what your, dad says about the way medicine has changed and, over the years. So that would be interesting.
Well, we talk about it. He loves what we're doing now. In fact, he had always said, don't go work for a hospital system, and I can see pros and cons there, because he was always in a private practice and he struggled some years.
Yeah. Some
years insurance beat him up, but he said, you know what, I got to do it our way. And we took care of patients, and honestly, it's taken us a couple years. Like, if we weren't if we had not been out and saved our money, like we're penny pinchers, all three of us. So we had the resources to where we've had a couple years where we're not making money. We're like any other business starting up. Like we're trying to get the business going. And most people can't do that. Like I said, physicians come out of residency in debt and stuff. They just can't afford to do that. They don't know how to do that. So we were able to we've kind of weathered the storm now to where we're on the other side. But I'm able to sit down with a patient for at least 30 minutes. Like I have no less than a 30-minute appointment when I have a patient come in. And they don't get the one visit, or they don't get the one problem visit. Like they come in and like they've always done, they're going to say, I got all these things I want you to look at, or, what about this and that? And we actually have the time to sit down and say, let's go through it.
Do you find that most of your patients, are they really engaged in learning and understanding their own health journey, or they rely? My experience is that I think I used to rely a little too much on my doctor's opinion without doing my own research and trying to understand personally. Does that make sense?
Well, I think it's the opposite now. Most of the time I have people come in and they'll say
they've Googled it.
They've listened to a podcast.
Or they saw something on social media, right?
And I tell people, listen, okay, that's my job, is to take all this information and say, is this legitimate? Is this a good study? Is this a bad study?
Fair enough.
And I tell people, listen, the other thing is I don't argue with success. So there's certain things, supplements that I may say, that's probably gimmicky. They're probably just trying to make some money off that. But you know what? If it's not hurting a patient, and there's certain ones I recommend, but if they feel better on that certain supplement, and I know it's not affecting their bodies in a harmful way, I'm like, yeah, go for it. Listen, just don't spend a bunch of money on that. Like, but let's eat right, let's exercise, let's do the things we know helps. And then, if you want to, whatever this supplement is, let's be careful with that. But
where do you see medicine going in the next 20 years?
Well, you talked about where's it going. I think, I tell you, you're seeing a lot of burnout. I see a lot of traditional practitioners that are burned out. You've gotten to where now it's being pushed. Like a lot of providers are being incentivized to do a lot more Medicare annual wellness visits, which if you look at what that entails, it's me asking people if they're depressed, if they've had any falls, if they're up to date on the vaccine, like just some questionnaire stuff. It does not involve a physical exam. It doesn't involve talking about actual medical problems, making sure those are optimally treated and stuff. We've kind of shifted more towards that's incentivized more than the people taking care of actual medical problems. That's scary to me because now all your acute problems are now being shifted to urgent care in the ER. Like if you call an office, 9 times out of 10, they're going to tell you, I'm sorry, they can't see you today. Or
that quick, they can't see you quick enough.
You need to go to urgent care. Now, who do we have in the urgent cares now? I mean, they're basically urgent cares are going to find, typically it's going to be a mid-level, and don't get me wrong, there's lots of great mid-levels. But some of those folks are very early in their careers. Some are very poorly trained. And so anybody goes in there, you got a diabetic, hypertensive, history of coronary disease or whatever, and they go in there with any type of medical problem so maybe they have a little chest discomfort or something like that. I mean, and some things are appropriate, but if you go in there with any problem, they're most likely going to get shifted to the ER. So now we've got an urgent care cost, and they probably protocoled them. So there's a $300 bill there, and now we're at the ER, and now we're running up a $3,000 bill. And a lot of times they get all this labs, they get all this imaging, all this stuff done, and they say, well, you're not dying, go follow up with your PCP in a week. That happens all the time. So then they come in, in a week, and it's like, wow, you had a lot of stuff done. I wish I'd have known that and gotten to see you, because I would have,
sure,
we would have avoided all that stuff. Or we could do testing there, but that's kind of where medicine is. We're having to fit patients in. Most places don't fit in, don't squeeze patients in anymore. Like I would always work them in. I'd just skip lunch or whatever, because you want to take care of folks. You don't want them to have to go to the ER. You don't want them to go to urgent care.
Well, I will admit the last time I went for a unscheduled, I do, listen, I get physical once a year.
Yeah.
I get blood work once in between because of family history of cholesterol. And so But the last time I went, it was, I saw the PA, that my primary care couldn't see me quick enough for what I felt like I needed to see. And you know what? Turns out I probably could have waited. Right. So that's a good example. So anyway, these are all curious conversations. I'm afraid we could talk about this for 3 hours, and we're not going to allow our listeners to endure that, or me and you endure that. And then Naomi would probably kill us if we talked for 3 hours. She would be putting a stop to it. So if you don't mind, I'm going to just shift gears a little bit. What led you? Obviously, you're embedded in the community. You're raising your children here. Yeah. Our first real connection was at Rotary. Yeah. So what led you to the community side and seeing, just what kind of led you on that journey?
Well, honestly, I didn't have time to do that before.
Okay, fair enough.
The reality is, my job, and I take care of patients day in and day out, which is unique compared to a lot of other jobs. But I just honestly did not have any more time to do anything like Rotary. There's no way I could make it to a Rotary meeting traditionally. So this job has allowed me to have, more time to do things like that. Like it is more an 8 to 5 job, and I can take phone calls. I meet people at the office if they need something, whatever, but it's not a volume business. That's the difference. Like the way our practice is now, we're not driven by volume. Like I don't need you to come in if you don't need to come in. Right. There's a lot of stuff I can talk to you about.
Yeah, but what I really mean with the question is, so you have the time now, but you could have filled that time with something else, is my point. So what lured you, why did you think getting, because Rotary is a service club. That's its mission. And I know I'm sure with your kids being at Gaston County schools, I'm sure you and your wife are involved in some of that as well. Yeah. So what led you to be, led to say, hey, I want to get involved in that in an organization that's serving the community?
First and foremost, I'm a Christian and want to serve others. And it used to be filled with serving my patients, and now I have opportunity to have time to do other things. And so I always found Rotary to be great. I've seen what Rotary does, and I once again trying to find other ways to serve and get to know people and get to know more people in the community and stuff like that. So it seemed like a perfect fit to me. I've been fortunate. I've been in Rotary now for 24 years. And so I agree. Somebody asked me to come. They think, I'm the president years later and still involved, and I'm on multiple committees. Like tomorrow, we're recording this on Wednesday, the 16th. Tomorrow, I think I'm doing health and happiness, so I'll get to, I actually to annoy people with some of my dad jokes tomorrow. Yeah. To that. I actually feel bad that I can't do like all these things come up and it's like, man, I want to do that. And, of course, kids or something like that.
Well, work and life happens.
Yeah. But it's been great. Like I got to go help build the beds and stuff.
Oh yeah. That's cool. That's a great project. Great,
yeah. And what's funny is I get there and
I think we have them coming on, don't we? The Heavenly Beds people there, they're scheduled to come on sometime soon.
That's very, it's just a great thing to do.
So what about things like, you talked a lot about your dad, and I'm the same way. I was never going to do this business, but here I am.
Yeah, right.
A family business. Actually, same thing my dad did, and so I was not going to do this no matter what. But it's been terrific. It's been terrific though, right? And so something I like asking questions like. Is there a lesson, best advice you've ever gotten, a leadership lesson, just something, because, we're big about leadership here. And frankly, if you're in Rotary, you're in leadership. If you are involved running a business in a community, you're in leadership. If you have a family, you're in some type of leadership. So is there something that comes to mind, somebody that gave you a great piece of advice, or, the leadership lessons you've learned along the way?
Well, like I said, early in my practice and my dad also, especially for our business, it was putting others first. I tell people that all the time. When I would have new people come in and we'd be recruiting other providers and stuff, or meeting with the marketing team, I tell them, listen, guys, if we take great care of our patients and we put them first, and we bend over backwards to make sure they're taken care of, everything else takes care of itself. Okay. And and as a leader, if you display those qualities and you live by example, to me that that speaks for itself. Of course, if I'm yelling at people and telling them what to do, and then they turn around and see me, right? But And I used to love when patients come in and say, "I bet you play a lot of golf, don't you?" I'm like, "Oh yeah, all the time." I was like, "Yeah, that's." And then they're like, "I bet you're driving that Mercedes out there." And so I'm like, "No, I got the '06 Tahoe out there. That's got 150,000 miles." Yeah. I'm like, "Come on now, that's just."
Well, there's that. Well, that's the media TV image, right?
Yeah.
Of every physician.
Actually, this is a pretty funny story. Talking about living, like my thing is live by example. But I remember going to Sam's Club one time, and there was this older gentleman who's diabetic, and the guy's in there, and he's going around hitting all the snacks in Sam's Club. Going around and tasting
the samples.
The samples. Yeah. So I walk up to him and I see him, and I kind of put my arm around him and said, "You sure you should be eating that?" And he looked at me and he was just shocked. And I thought I got him, he's like, "I'm sorry, I shouldn't be." He said, "I didn't know you came to places like this." And I was like, "What are you talking about?" He's like, "I thought you had people that did this for you." I was like, "No, my slaves are off duty right now. I had to come to say."
Well, that's funny.
It's like, come on. Yeah.
Well, you know what? That goes to a lot of, especially social media and just so many things that we do stereotype, and we all, we all do it. I'd like to say that I don't do that. I don't judge. Of course I do. Right. I mean, so, okay, looking back, is there something community, family, business, something you're most proud of accomplishing or seeing accomplished, or that you've touched or been involved with?
Well, I don't have, we raise kids here, and I don't.
Well, surely it's that your son went to NC State. Surely that's the greatest. That's what you're most proud of.
I was about to say he hadn't gone to jail yet that I know of, so I'm proud of that. But
I know that's a tough question.
It is a tough question.
It's also a tough question for a humble leader to answer.
Okay. Well, good. Okay. Well,
so we don't want to. We don't want to. That feels like we're putting, the light on ourselves. And you've already said that's.
Yeah. I'm really proud of myself and my partners for the practice we have and what we've tried to do. And, and just, being able to take care of patients and stuff. And to us, that's probably the best thing we do for serving the community. And, if somebody needs something, for them to know that they can come to us and can call any time of the day, or, and most people actually respect your time, and if I see them out in the community, they're like, "I don't really want to bug you," the kind of thing. But well,
you know what I've learned? I want them to come bug me about our business, because otherwise they might talk to somebody else.
Okay,
I want them to come to me, right? I'll even ask. So I know, hey, Brian, I saw on our board, we were out at your house last week. Is everything good? I'll ask those type of questions. Now, when I was younger, I think I did avoid that, right? Like, oh God, did we do a good job? Did we? I don't think I want to know. But now, I'm very intentional about. That's a great point, though, right? I think they people. Southern people, especially, they're respectful of your time, and they don't want to bother us.
And we love. I want people to have good outcomes. Like I tell people all the time, this is not a business where people are numbers or anything. Like I literally feel bad if somebody has a bad outcome. I had a patient had a stroke the other day.
Wow,
he went to the hospital. I feel terrible about that. Like, and it has nothing to do with me. And actually, I was communicating with him the whole time he was in the hospital, because. A lot of times they don't get answers. Like it may be the next morning or something before they get answers. So we were kind of communicating back and forth, and I was telling them what he could expect and tests they were doing and what this test showed and what we're going to have to do and how we're going to try to avoid any problems in the future. And it was one of those things that wouldn't have been avoided. There's nothing we could have done about it. But, I form relationships with folks.
And, sure. We do the same.
Yeah. I think that's what it's all about. I think,
do you have employees at your practice?
Do we have employees at our practice?
Yeah. Well, that's another community service that I think is undervalued for business owners, right? So you have families that are relying on you to keep your act together.
Right. Yeah.
That's big. Yeah. That's big pressure. I feel that here, where we have 200 50 plus families who are relying on my brother and I, not to do something stupid.
Sure.
So, I think that does get undervalued. And ultimately for me, that's really frankly, that's what runs the country, in my opinion. It's not these big, giant corporations all the time, but it's the, over 50% of people work for small businesses, in the country. And so,
and I'm sure you see this, and I've heard, people talk about you guys and stuff, how you're great owners and bosses and all that stuff. You like to hear that. I mean,
sure.
You want your employees to feel like a family and to love working for where you're at and stuff. And we're the same way. Like,
absolutely.
We're trying, if they have something personally going on, like, listen, we understand. That's okay. If you have to be late or whatever, that's cool.
Oh yeah. Well, you know what? It's important that our coworkers can get to their kids' baseball game.
Absolutely.
Or whatever, as an example. We want to work that out. No matter, we will work hard to get that worked out.
Right.
Because ultimately that's important, right? And that makes a better coworker too. I mean, it makes a better community person. It makes a better coworker. It makes a better family. I mean, so, that's kind of the mission behind a lot of the things that we try to do.
And we tell our employees, listen, we're taking care of patients. That's our job. If somebody calls, we want you to answer the phone. We want you to be nice. We want them to, maybe they're not feeling good. We want them to feel good. Like,
Yeah, it could be similar to our business. Like, people don't wake up, well, I can't wait to call my doctor today. Yeah, that's typically not happening, right? So most of the time, people are calling us, their roof's leaking.
That's right.
They're hot, they're cold, something's going on, right, oftentimes. So they're not typically happy to have to call us sometimes.
And when they call with that type of situation and you say, well, we can't get anybody out there today, it'll be next week. Yeah. That's not going to be what
they're going to call somebody else.
Absolutely. Well, they're not going to be happy either, right?
Right.
They're going to say, well, I'm never calling them back. Well, if they call my office and say, hey, I cut myself. Can somebody see me? And I say, well, I'm sorry, go to urgent care. That's not good.
Yeah.
I think that's bad medicine.
So we're going to start to wrap this one up, this 30-minute episode that's at 45 minutes now, because I can't ask good questions, Naomi. So one question I do like to ask at the end, near the end of every episode, is, Brian, knowing what you know now, what advice would you give your 20-year-old self?
Well, I would give myself the same advice I give my kids, is that God has a perfect plan for your life. And there'll be times where you think you're in a hole, or, this is a terrible situation. And what you need to realize is that the sun's going to come up tomorrow. And, you just work hard, you keep your faith. And those are usually the times in your life where you learn the most. I've had total failures, growing up and stuff through my life, that have taught me the most and taught me to be humble. And
it's unfortunate it takes that sometimes, isn't it?
Does. My dad always told me there's only one way for you to learn. That's the hard way. And he told me that way too many times, but he was right.
Yeah. And when you're 20, I know I say this, I bet 120 out of the 150 previous episodes talk about perspective.
Yeah.
Man, if I could have my perspective now when I was 20.
Well, I always like the word wisdom.
Yeah.
Wisdom comes with time.
Correct.
And experience.
And I'm afraid it takes that, right? I almost, for me, it was impossible for me to have that perspective and wisdom at 20.
Sure.
I just couldn't.
Yeah.
All right. So this has been a really great discussion, Brian. So anything you want to share, about your practice, the name of it? Are you taking new patients? I mean, anybody that takes the time to come talk to us, I want to give you the opportunity to talk about your business or anything, and find you online or anything you'd like to share.
Yeah. So it's GastonFamilyPractice.com is our website. I'm always happy to talk with anybody, and even if they're not joining our practice, and it may not be right for everybody.
Correct. Absolutely.
But I'm always happy to talk about the business of medicine. Like, we have people in our Rotary Club that have found this fascinating, like how this works. And they're not members of our practice at this point, and that's fine. Like, I always love answering questions, and I have people, ask me medical questions. I'm always happy to share knowledge, or maybe give them some insight, or maybe what they need to do and that kind of stuff. But we're always happy to meet and talk things through, and give them a tour of the practice, explain how this works, explain how they may be able to change their insurance. We're now going to businesses and stuff and and talking to them about the options they have, and pairing them with DPCs and stuff. So we're kind of like, our initial phase of our practice was going to individuals because we wanted we try to incorporate all our prior patients. And some of those still don't understand it. Like, I still have patients every day that are coming by and say, well, I didn't understand what a direct primary care was. I thought y'all were concierge. Hear that all the time. I'm like, well, that's fine, but you can stop by any time and we can talk about it, and I'll explain to you the difference and how that works. But now we're kind of transitioning over to businesses and stuff too. So I've invited businesses, like my friends down in Greenville, Spartanburg do lunch and learns and things like that. I'm always happy to meet with, business owners or people that are struggling with healthcare expenses, because for even our business, it was crazy. I'm shocked at how much we save, and there are other options. The issue is that most brokers are going to sell traditional insurance because that's how they make money, unfortunately. Sure. And I understand that.
And that's what they know.
And I understand that. Yes, absolutely.
Yeah. Absolutely. I mean, our industry is changing all the time. I mean, we're in the process of another refrigerant change. We went from Freon to what we call R410A. Now it's R32 and R454B. So, I mean, those numbers probably mean nothing to most people, but so it's a total shift in how we have to do things. And so it's just interesting. So I mean, I'm always about learning and hearing something new and something different. So any last words of wisdom before we close this episode out?
No, I appreciate you letting me come. Yeah, this is great.
Oh, absolutely. It's always a pleasure to talk to you. So I'm going to share a quick book recommendation. In the past couple of months, I've read a lot. That's our last episode, but I finished a book by a gentleman named James Rhee. I think I'm pronouncing that right, Rhee, called Red Helicopter. Man, and it is a great read. It's what I would call inspirational business type of book. There's a great TED Talk he has you can find on YouTube or go to TED.com. Again, James Rhee, about his journey helping turn around a business and the why behind it. Again, it's just a great one. I would highly recommend it if you're into that type of reading. So, as always, to our listeners, thanks so much for taking the time to listen to today's episode. And please continue to spread the word if you can about the podcast. And please don't hesitate to contact us here at our email address, which is podcast@gastonsgreat.com. We are always looking for suggestions for future podcast topics and guests, especially anybody who's involved in the community. They run a local business and are also involved in the community. That's really kind of we want to talk about that connection between business and community and leadership. Is kind of really where we're trying to get, because I think we got some great people, not just great organizations, but some great people here in our community who can share a lot of their story. So you can find the podcast and subscribe at the website, gastonsgreat.com, or anywhere you listen to podcasts. And please follow us on all our social media platforms. Thanks again to Brian for being our guest today. Gaston's Great is produced and brought to you by Naomi Hunt and Amy Anderson from GSM Services. I'm your host, Stephen Long. Thanks again for hanging out with us, and please keep coming back to hear more reasons why Gaston's great.